you guys know the difference between a general practitioner and a specialist?
I don't.
Well, a general practitioner treats what you have, and a specialist thinks you have what he treats. Okay, well, you caught us again with a little dad joke there, healthcare variety, but welcome and thank you to the Whole You podcast, brought to you by Nebraska Total Care. I'm Dr. Chris Elliott, the Chief Medical Officer for our health plan, and we sure appreciate you joining us today. I have with me today Kristi Goldenstein and Paula Stapleton, so thank you for joining us. Our topic of discussion is going to be diabetes, how you diagnose it, treat it, and really how you live your life if for some reason you've been diagnosed with diabetes. So everyone knows, or a lot of people know, there's two types of diabetes, type 1 and type 2. Type 1 we really don't have any control over. We really don't know exactly what the cause is. You know, we kind of have a theory that it might be caused by a virus, some sort of environmental toxins, things like that, but it can show up anywhere from very young age to all the way through adulthood and so forth. Type 2 diabetes is probably what we're going to focus on more today. That's a diabetes that used to be for middle-aged and older people, but it's amazing how we're seeing that it's showing up in younger and younger people, even preteens and teenagers at this point in time. So it's really a big topic of today, and we're hoping to educate people and help them on their healthcare journey so they can stay healthy. And so with me today I have Paula Stapleton, and she is our Director of Clinical Operations here at Nebraska Total Care. Thanks for joining us. Tell us just a little bit about you and your background, Paula.
Yeah, so as Dr. Elliott mentioned, I am a Director of Clinical Operations here at Nebraska Total Care. I am a registered nurse. I have my bachelor's degree of science in nursing. I've been here at Nebraska Total Care since September of 2019. Prior to being here, I did home care for 24 years. So having a variety of patients gave me an opportunity to work closely with diabetic members and giving them the tools and resources to manage that and live at home independently.
Fantastic, yeah, appreciate that. And Kristi Goldenstein, you're our Manager of Community Health Services. Tell us a little bit about yourself.
Yeah, so I've also been with Nebraska Total Care about 4.5 years. Prior to that, I have done a lot of work in child welfare, and I've also been a medical social worker at a hospital. So my background is really in social work, and I do have a master's in social work.
Okay, very good. And again, I'm Chris Elliott. I'm Chief Medical Officer. My background is in emergency medicine. I was in the hospital for about 30 years before I came here a little over 2 years ago. And so we're all happy to be part of our team, healthcare system throughout Nebraska. And again, Nebraska Total Care, we have 3 different products, you know, for our health plan. We have Medicare, we have Medicaid, and then we have a marketplace what we call Ambetter and so forth. So we're positioned throughout the entire state to take care of pretty much anybody and everybody from birth to old age. And so it's a great position to be in and to be able to help as many people as we can. So type 2 diabetes and diabetes in general is caused when the pancreas really either stops making insulin or the body just doesn't really have the ability to use insulin anymore. And you know, there's different things that we can do to try to treat that or try to ward it off if we might be at risk of having diabetes and so forth. And so, Paula, tell us, what do you think, what are risk factors or what might put somebody in higher risk to develop diabetes?
Sure. Some contributing factors to put a person at risk would be being overweight, having a larger waist circumference, not getting enough physical activity or exercise. Smoking is a contributor, as well as having hypertension or high cholesterol, and even family history can be a risk factor for being a diabetic.
Very good. And you know, blood sugar or glucose is in pretty much most foods that we eat, and we all need it to survive. But what happens is, especially in our Western diet, we have a lot of simple carbohydrates, a lot of sugars in our diet, which spikes our blood sugars and causes a little bit stress on our body throughout the years if we continue to do that. What is a normal blood sugar?
Yeah, so there's usually 2 blood sugars that they're checking. One is fasting. A fasting blood sugar is usually checked when a person hasn't eaten for about 12 hours, and that normal range is 70 to 100. There's also a random blood sugar, and that can be taken at any time. Generally, things that are going to affect that would be how much food the person had eaten, what they ate, how much time had lapsed between eating and taking that blood sugar, and the normal range for that should generally be below 125.
Okay, very good. And I think you mentioned before that, you know, with diabetes, there's risk of high cholesterol and hypertension, which is just another fancy word for high blood pressure.
Yes.
Yeah. And as we kind of try to, you know, educate people about diabetes and so forth and what to kind of look for, we can go to our doctor, we can get our blood sugar checked and so forth. But are there other warning signs that we might know of, even in our day-to-day life, how we're feeling or what might happen, that we might say, oh man, maybe I should go get checked?
Yeah, definitely. Some early warning signs might be frequent urination, excessive thirst, maybe feeling more tired, fatigued, dry, itchy skin, and even unexpected weight loss can be warning signs for both type 1 and type 2 diabetes.
Yeah, very good. And then if you do have those symptoms and you say, hey, can I come see you, doctor? What kind of things will they do to try to see if you do have diabetes or diagnose that?
Yeah. So when a doctor is going to check to see if you have diabetes, a lot of times they're going to check and do some screenings. That's going to include checking how much sugar is in your urine. And then they're also going to do the random blood sugar checks or a fasting blood sugar check like we had discussed a little bit ago.
Okay.
And then if a person already has diabetes, the doctor's going to be more focused on how well you're doing at keeping those blood sugars within a normal range. And so they're going to be more focused on that hemoglobin A1C number, and that's going to show those ranges and how well you did at keeping them in a normal range over a 2 to 3 month period. And a normal range for hemoglobin A1C, you want that to be below 5.7. If you have a hemoglobin A1C between 5.7 and 6.4, then that's also an indicator of prediabetes.
Very good. And these numbers that we're talking about are just kind of, you know, you might get a screening blood work from your doctor during the year, and you don't have to worry about, you know, exactly what they mean, but you'll look at those numbers and you're like, oh man, what does that really mean? And so if it is out of range in that respect, that's something that your doctor will want to talk to you more about.
Definitely. Mm-hmm.
Yeah. So Kristi, you and your team doing a lot of diabetic teaching and coaching and things like that. What are some of the lifestyle habits and things that you try to educate our members on to help them in their lifelong health journey?
Yeah, so we do a lot of coaching on nutrition. So being able to count carbs, limiting sugary foods or drinks, also increasing exercise and movement or even strength training, just any ways that you can really incorporate a little bit more movement and exercise into your daily lifestyle. We also talk with our members about medications and managing them, how to track their blood sugar so that they can look for any trends to talk with their doctor about. And then we can also coach on quitting smoking if that is something that the member is experiencing or needing some help with, and really just being able to meal plan and set, you know, how are they going to manage their nutrition moving forward.
Yeah, there's so many things that can be done before we have to jump to the medication route. Mm-hmm. And that's the neat thing, you know, especially if we're adults and we make those lifestyle changes. And it's very rewarding to see those members, you know, follow those plans that you and your team lay out for them. And then their blood sugar drops and they don't have to go on medication. Yeah, very fantastic. Now, it's probably a little bit over you know, depth that we want to get into now, but there are several medications that we can utilize if for some reason blood sugars are staying high even after all these different you know, lifestyle modifications have been put in place. There's medications, you know, that can work on the liver to decrease the amount of glucose that's made. There's medications that work on the kidney to increase the amount of glucose we excrete in our urine, so that's not traveling on our bloodstream. There's different types of medications that, you know, affect different hormones in our body to either help us to make more insulin or to make our tissues more sensitive to the insulin that is out there to help utilize that blood sugar. And so it's good to know that we do have a lot of strategies to treat diabetes and so forth from one continuum to the next to support our members, which is fantastic. Paula, one more topic, that thinking about, your expert staff and all of our support programs at Nebraska Total Care. Tell us a little bit more about that.
Yeah, so we have a range of integrated staff focusing both on physical health and behavioral health components for our care management team. The more complex nurses that we have are going to be able to help members on that journey as they're learning about the diagnosis, maybe a recent diabetes diagnosis, giving them the tools, resources, education to help support that and manage that independently. As Kristi mentioned, members of her team are also able to meet with the patients face-to-face to actually see what type of foods they have in their home, talk about portion control and different things that they can also be more effective with managing in that realm as well.
So after we've diagnosed with diabetes, there's some things that you want to do at home to monitor your blood sugar and make sure that these different interventions, whether it be lifestyle modifications, medications, and so forth, are really working. Can you talk to us a little bit about that?
Yeah. So a lot of times the doctors are going to want you to check your blood sugars on a regular basis just to see where they're falling. That helps, identify the types of food that you're eating, how your body is reacting to medications that you might be on. And so there's glucometer checks, which is going to be a finger stick, and you're going to log those recordings in a journal. You're usually going to do a finger stick with the glucometer before meals, at bedtime, and then when you log those, the doctor would love to see those when you go to your next appointment so they can understand how your body is reacting to medication if you're on it. If you're not on medication, maybe you need to be starting medication, and they can make those adjustments effectively based on where your ranges are at. There's also a continuous glucose monitor, and that is a little sensor. It's under your skin, usually in your arm or in your stomach, and that is an ability to check your blood sugar real time throughout the day at any given time, and you can recognize more trends with maybe morning or evenings and be more readily adjusting your daily habits based on what exercise you're doing or what you're eating, and then have access to that to be more mindful.
Yeah, it's amazing the technology anymore, because those glucose monitors used to be big, but now they're just kind of little tiny patches, and it hooks up to an app, doesn't it?
Yes, it does.
And so you can set parameters on your phone, and if your blood sugar goes too low, it alerts you. If it goes too high, it alerts you. And so it's really amazing things that we can do to keep track of it that way. Another very important thing as we watch blood sugars in the treatment, almost as dangerous as too high blood pressure is too low, right? And if a blood pressure drops too low, we know that you can get dizzy, lightheaded, pass out, lose consciousness, and so forth. So it's very important to follow your blood sugar closely when you're on treatment and so forth. Any other things that you want to tell our members and audience about how we support them through their diabetic journey?
Yeah, I think one other important thing is any of our members in care management, as well as our coaching programs, we really try and focus on their drivers of health too. And so those are those social aspects or things outside of the member's control or their environment or things that they're experiencing that can really have an impact on their health. So making sure that they have access to food, making sure that they have transportation to get to their appointments so they can see their doctor and their specialists and be able to follow those recommendations and take care of their health. Those are all things that we talk with our members about, and if they are having struggles in those areas, we can help them with some community-based resources. And even at Nebraska Total Care, we have access to some of those as well. Our members can have transportation to their appointments through MTM, our vendor for transportation.
Those are members with our Medicaid product.
Correct, yes, thank you for pointing that out. We also have a value add for our Medicaid members for the YMCA, so they can get a membership and be able to go to the YMCA to really work on that increased movement and exercise. We also have community gardens that we can help our members locate and be able to get started so they can grow their own healthy food. food. So even if it's something outside of what Nebraska Total Care has to offer, we really try and link our members to some community resources that can help them too.
That's fantastic, yeah. And one of the really fun things that we started just last year, and you were kind of the director of our community garden, we started our own community garden within Nebraska Total Care. All of our employees in North Omaha, Florence area, we have a couple of boxes in the community garden, and we planted our vegetables and so forth, and we were able to distribute them to some of our members with diabetes and really help them, instruct them on healthy eating and so forth.
Yeah.
Well, it seems to be kind of a recurring theme in these podcasts that, Nebraska Total Care is more than just an insurance company. We're here to support our members along their healthcare journey any way we can, whether it be, health problems like diabetes or high blood pressure, whether it be social issues like transportation or food insecurity and so forth. We just want our members to know we're here waiting for their call. They can contact us by email, go on our website and see all the different support structure that we have and the services that we have set inside, and call our hotline as well. Any way they want to contact us, and our team, our community resources are ready to help them. So thank you so much. Anything else that you have today that you want to discuss?
I don't have anything else. Thank you.
Well, until next time, this is Dr. Chris Elliott again for the Whole You podcast, brought to you by Nebraska Total Care. And we really care about you and your healthcare journey. And when you feel well, we feel well.